This is Combat Game. Today I'm going over the 10 most serious side effects of turmeric, curcumin, and how to best take it. And we're starting now. Turmeric is an all-natural spice. Taken 500 milligrams to 2,000 milligrams per day. It's eaten regularly in an Indian diet. It's usually safe and non-toxic. It's very well studied, and it's most famous as an anti-inflammatory, but it does a ton of other things. And some studies do show that it's more effective than anti-inflammatories like ibuprofen. But there are some side effects to be considered, and that's what we're going to go over in this video. If turmeric curcumin is worth it. So what's the difference between turmeric and curcumin? Turmeric refers to the root or the plant. It's not always pure. There are some oxalates in there. Curcumin, on the other hand, is the active ingredient found within it. Most of the new supplements are now 95+% concentrated curcumin. So you're not really taking the turmeric root anymore in the supplements. It's usually the curcumin. We're going to go over the big secrets on how to get the most bang for your buck from your turmeric, your curcumin. It helps with osteoarthritis, joint pain. There's huge benefits to taking it. One of the most popular supplements on the planet. There is a lot of complicated science behind how turmeric and curcumin works. It does so many different things. It inhibits necrosis factors, cytokines, COX-2, and lipooxygenase. It functions as an antioxidant. It can change cell growth and even cause apoptosis, so cell death of bad cells. So it's said to help with some cancers. There's 10 big side effects that you have to be careful for, people that have to watch out for it. So we're going to start with those, then we're going to go over the pros, the cons, and who should be taking it. In the countdown of biggest side effects, number 10, skin reactions. A study and published cases of allergic reactions like contact dermatitis. So if you start taking it, your skin's itchy, scaly. This has been reported in the Contact Dermatitis Journal in 2009. Just be careful. Number 9, if you're pregnant, turmeric has not been well studied. So studies in pharmacology journals, especially in 2018, raised the concern that if you're pregnant, you probably should not be taking turmeric. Number 8, low blood pressure or hypotension. High doses of turmeric might be said to lower blood pressure excessively in individuals, especially if you're on antihypertensive medications. These are like your beta blockers, ones that lower your blood pressure. This is in the Journal of Renal Nutrition in 2014 discussed this potential risk. If your blood pressure is too low, don't take it, or if you're on those medications. Number 7, gallbladder contraction issues. If you have gallbladder pain, abdominal issues, one of the biggest side effects is nausea, vomiting, cramps, diarrhea. So just be careful. The gallbladder essentially creates bile into your digestive tract. Turmeric can squeeze that down, cause a little bit more pain. A study in 2011 went over this. So just be careful if you have gallbladder issues. If you've ever had issues like gallbladder surgery, gallstones, or gallbladder disease or inflammation, turmeric might not be the best solution for you as it does stimulate bile. Number 6, increased risk of kidney stone. I talk about this a lot, but Dr. Stephen Gundry, the plant paradox, he's all over the oxalate content, kidney disease, inflammation. I think a lot of research shows that this concern might be overblown, that this book might be used to drum up some interest in his books. I'm not as concerned about oxalates, but turmeric is well known for its high oxalate content. And where this is important is kidney stones. And you know what, not to get off topic, but the big concern of too much oxalates is high inflammation. But the biggest benefit of turmeric is lowering inflammation. So is that a paradox on itself? Maybe I should write a paradox book. But there was a study in 2008 in the American Journal of Clinical Nutrition reporting the urinary oxalate levels after turmeric consumption did increase. So kidney stones, something to be concerned about. If you have a history of these, might not want to take turmeric. Curcumin is actually very healthy for the kidneys as an antioxidant and as an anti-inflammatory, but turmeric root itself is not pure of curcumin and it does contain oxalates. And too much of these without hydration can affect people who are susceptible to kidney stones and create further kidney stones. Number 5, GI or gastrointestinal issues. High doses, we're talking like 1,000 milligrams over 500 milligrams, can cause diarrhea, nausea, stomach upset. This is documented in the Journal of Clinical Pharmacology in 2013. These are high dose side effects. I think with reasonable doses, a little bit less concern, like 60 to 100 milligrams, like adding it to a dish. that might not be a huge concern. But when you're taking these super supplements that are like 1,000 milligrams with supercharged additives, that might cause some issues. Number 4, blood sugar lowering too much. A study for some diabetics can show that blood sugar actually decreases too much. So you can have too much of a good thing because most diabetics want to lower their blood sugar. If it lowers too much, you can get dizzy, you could pass out. This was a study in 2013 that highlighted this risk. So just be careful if you're diabetic. Don't go too crazy with high levels. Curcumin really helps with diabetes. It's said to be an antioxidant, help inflammation, thus improving insulin sensitivity, beta cell function, and actually helps store sugar in the liver. Number 3, drug interactions. This is the most challenging part of medicine, and this is why I always warn people to check with your doctor. When you're on medications like low blood pressure medications, diabetic medications, antibiotics, other things, this is number 1 going to cause upset stomach issues, interaction issues. Another big one is if you're on blood thinners like warfarin, there's a lot of other new ones. This can lower your blood pressure too much. It can thin your blood too much. It can cause a lot of adverse effects. It gets very complicated. There's a lot of studies looking at this. Number 2, iron deficiency absorption issues. Turmeric can potentially inhibit the absorption of iron. Turmeric is fat soluble. It's best to be eaten with meals. People who have anemia are susceptible. The Journal of Medicinal Food in 2009 found that this might be an issue and a potential side effect. A famous side effect of high-dose curcumin is that it can bind to iron in your gut. So anemia is when you don't have enough red blood cells to carry your oxygen. You feel tired, you feel fatigued, and what happens is when you eat turmeric, which has curcumin in it, it can bind to iron. And when it binds to that iron, it does not cross your stomach lining, and thus your body can't create red blood cells, which require iron to bind that oxygen. So as a result, you're tired, you're sleepy, and it can also interact with medications that can cause this problem as well. But number 1, I already kind of mentioned this with drug interaction, but increased risk of bleeding. The most serious concern with turmeric is if you're on blood thinners, if you get cuts, you have a hard time creating blood clots. You have a hard time thinning this. You can have internal bleeding if you're taking excessive amounts. Essentially very, very high dose. If you're on other medications, just be careful. Curcumin works at various stages of the blood clotting cascade. It stops the clot from forming and stops certain clotting factors from working. It reduces chronic inflammation. This is considered a good thing in a lot of people. It's an anticoagulant, but if you take too much or if you're on other blood thinners, it could increase your risk of bleeding, especially if you're going for surgery. But here's the 5 benefits of turmeric. Number 1, skin health. A 2018 study showed that skin, such as anti-inflammatory, antimicrobial, antioxidant properties, this can help with psoriasis, dry scaly skin, acne, something to consider. Number 4, digestive health. Even though the number 1 side effect is diarrhea, nausea, taken in reasonable amounts, like adding it to food, can help with digestion. That's according to a 2020 study. Can alleviate bloating, gas. This can be beneficial for inflammatory bowel diseases and gut health. Number 3, cardiovascular and vascular health. So a study in 2019 highlighted that curcumin and turmeric can help with endothelial function and potentially help with cardiovascular health. This may reduce heart disease and improve vascular health. And that's what anti-inflammatories like curcumin do in general. Number 2, brain health and mood regulation. A 2021 study in Frontiers in Psychiatry found that curcumin can help with treating the symptoms of depression. This is something to potentially explore a little bit more in cognitive functions, but what it all comes down to is number 1, curcumin is well studied and well known as an anti-inflammatory, pain relief, osteoarthritis, muscle pain, rheumatoid arthritis, chronic inflammatory conditions. I go over in another video a meta-analysis that looks at 66 studies. There's high-level randomized controlled trials, lots of other studies. Almost all of them show that curcumin and turmeric can help with inflammation, can help improve osteoarthritis symptoms, joint pain, muscle aching. It can provide relief in all those. It's been studied for a lot of different conditions. Curcumin specifically inhibits necrosis factors, cytokines, cyclooxygenase 2, lipooxygenase. It functions as an antioxidant, preventing damage to blood cells, specifically in endothelial cells, and it modulates cell signals. So specifically, if you have bad dying cells, this signals to kill it and helps cell growth as well. Now here's the important part, the dosage. In the typical cuisine, 60 to 100 milligrams of curcumin is great. That gets you a great result. That's what the standard diet is. But potentially that's not what's going to get you the best results. There are supplements where you can take 400 to 600 milligrams of curcumin. Now, we talked about some of the side effects. I always recommend for any patients taking any type of medication, start slow, kind of go up to the recommended levels from a lower level. See if you have any of these side effects. See if it's bothering you, if you feel weird, if you're getting tingling, any problems sleeping, any skin itching. For specific conditions, there have been studies for up to 2,000 milligrams of curcumin per day, like osteoarthritis and depression. I'm not recommending that. That's a little bit on the higher end. The Journal of Alternative and Complementary Medicine in 2016 used 1,000 milligrams for osteoarthritis treatment, had great results, but that's a little bit high. Out of the 66 studies that I mentioned, usually about 500 milligrams were used, but some of them used 1,000 or 2,000 milligrams per day, broken up into doses. When you get to the higher end, you tend to have more side effects. On the lower end, there's very little side effects. It's well studied, it's well proven as an anti-inflammatory. There's a lot of studies showing that it's just as effective as some anti-inflammatory pills, but too much can cause iron deficiency, anemia, and some bleeding risk. Here's my top 5 tips for regular intake. Number 1, take smaller doses, but continuously. So take a smaller dose once, twice, 3 times per day, rather than a huge dose. That's studied. Smaller, more frequent doses are more beneficial. And on that note, number 4, avoid excessive doses. The Journal of Pharmacology in 2007 showed that the high doses are really what lead to these side effects. So people that take too much, if you're taking more than that 400 to 600 milligrams in supplement form, if you're taking a lot of them, too much of a good thing is a bad thing. Number 3, check with your doctor if you're having side effects, if you're on medication, see if there's interactions or warnings. That's more of a medical disclaimer. I know you're not on YouTube if you were checking with your doctor. Number 2, eat it with fats and foods. Oils, avocados, meats, that's something good. It is something that's fat soluble, turmeric and curcumin. And number 1, here's the big secret. So they have done some studies, especially in 1998 in Planta Medica. Piperine, which is an extract of black pepper, has shown to improve the absorption by 2,000%. So curcumin was absorbed 2,000% or 20 times better if black pepper extract was available. So now supplements, almost all of the high quality supplements, and I do show some below that are pretty good ones, they do have basically 95% concentrated curcumin, and they do include black pepper extract in almost all of them. That's kind of the big benefit. Take it with some food. Don't take it on an empty stomach. Are these side effects a huge cause for concern? In most people, 99% of people, you're going to be in good shape, but don't take it on an empty stomach. Don't take too much. Start slow. Check with your doctor if you're on a ton of medications, especially blood thinners, especially anemia, especially if you have stomach issues. Those are the most common and concerning things. If that helped, check out my other supplement vitamin guides and the benefits of curcumin, the big secrets on osteoarthritis treatment, and my 30-day guide to turn your health around. Check that out below.